Recently, you're seeing on the federal level, PBMs are now starting to be required to report on drug spend, rebates, fees, anything regarding reimbursement because of this push to decrease drug prices for patients. And so PBMs, because they're kind of in the middle, it's an entity we can look at. We don't know a lot about that. Maybe we can get to the bottom of kind of why drug prices are skyrocketing, how we can figure out ways to reduce drug prices for people. Part of that to get started is to just get PBMs to report on what's going on, how our fees split, are rebates going to the patient, the payer, are PBMs taking a cut? So you're starting to see new rules come out about reporting some of those reimbursement issues and that data to both the federal government and the various state agencies. So now you're seeing about half states, I think, now have some sort of laws that require reporting and disclosures about pricing, rebates, reimbursement, and requiring audits of that same information, which kind of leads into the pharmacy compliance piece because you're getting a lot of that data directly from the pharmacies. And so a lot of that reporting and disclosure requires the cooperation of pharmacies. So now you're having all these pharmacies trying to harmonize all these different multiple requirements, especially if you have pharmacies working in multiple states. The data requirements are all over the place in terms of what you need to report. So it's really tracking that information closely, making sure it's documented, and it's readily available. And then I think one of the other challenges is all these different formatting and portals that all these different reporting agencies are requiring. So navigating that, and it's really kind of putting all of this administrative burden on pharmacies and trying to figure that out in this very rapidly developing area. And then I think the other part of it is most contracts have some sort of non-disclosure clause on pharmacies where they're not allowed to disclose certain reimbursement or pricing information. So it's kind of left up to them to make sure that they have the proper legal advice on what exactly they can disclose while also complying with the PBM audit requests. So it's a tightrope that they have to balance on and try and figure that out. So a lot of pharmacies, just especially smaller independent ones, aren't really equipped to manage all that information and get it out in a format that's accessible. Some states have started to make some of these rules permanent where they're expanding the role of a pharmacist in providing clinical services to patients. Usually it's pretty limited for the states that do allow this to independently prescribe or do initial therapy treatments for things like providing contraceptives, smoking cessation treatments, HIV prep, vaccines, travel medications, things like that. And you see it varies across the board on the states that do allow it. I think some of the problems that we're running into is that there's a disconnect sometimes between what the state rules are allowing and what the payers are allowing to be billed, or even if they're recognizing that a pharmacist is a qualified provider. So even if the state says, yeah, you can provide these clinical treatments, you can provide medication therapy management services, they're not being recognized by the payer as someone who can submit a bill for these clinical services. And then even if you do, sometimes the fee schedules are not that beneficial to a pharmacist, so they're not getting paid enough. They're not willing to take on that additional liability of providing clinical services without being paid in a manner that encourages them to participate in these additional roles. So you're seeing this misalignment between state rules, billing rules, payer practices, credentialing. And so we're kind of waiting for all of these different players to catch up with each other so that we can fully implement this new expanded scope of practice. And so, of course, as this expands, you're going to see more regulatory oversight, both for pharmacists, again, requiring them to do more record keeping, more reporting, more disclosures, because there's obviously a lot more at stake when you're providing clinical services. Um, so just kind of waiting to see how states continue to expand that role across the board and make sure that all the different players are in alignment so that we can have this additional access to care.